Hi, my name is Guillermo Rodriguez. I'm a biomedical engineering student at Universidad Europea de Madrid, and this is an inverted class for the module Diagnóstico por Imagen y Sistemas de Intervención. This class consists on the non-invasive fat removal processes. Class overview. I'm going to start introducing the field, then I'll talk about the market size and population demand for the fat removal devices. Then I'll do a comparison between the invasive and non-invasive techniques, continued by the explanation of two main non-invasive techniques: high-intensity focused ultrasound and cryolipolysis. Then I'll expose the main conclusions of the presentation to end up with a Kahoot. Adipocytes are highly specialized cells that play a crucial role in the energy balance of most vertebrates. Adipocytes convert excess energy to triacylglycerol and deposit it for periods of food deprivation. Adipocytes consist on one or more large triacylglycerol droplets. This type of cells aggregates in different parts of the body, forming, for example, a layer of subcutaneous adipose tissue. This layer is necessary for the correct function of the endocrine system, and also it's important in thermogenesis. In this class, I'm going to focus on this subcutaneous adipose tissue layer, specifically on the non-invasive techniques for the removal of its excess. There's a big problem affecting most part of the developed countries: the imbalance between the ingested and burned calories due to the mass consumption of hypercaloric food and sedentary life. This issue have carried a big part of the population to be overweight, accumulating big amounts of adipose tissue. This problem has become an important health issue, characterized by the dissemination of diseases such as hypertension, diabetes type 2, increasing cardiovascular risk, and generating physical and aesthetic dissatisfaction that, in some cases, induce mental diseases such as depression, bulimia, and others. These overweight problems lead people to perform aesthetic operations in order to remove, for example, the excess of subcutaneous fat, generating a big market that moves billions of dollars. For example, lipoplasty is the fourth most popular cosmetic surgical procedure in the USA. But this procedure is invasive, so it's linked to some risks, and also involves high cost. This generates a big market opportunity to the development of fat reduction non-invasive techniques, representing nowadays the fastest growing area on aesthetic medicine. The growing demand of methods of fat reduction is perhaps driven by the fact that over 69% of American adults aged 20 years or older are now overweighted or obese, up from 54% in 1988. In 2013, over 11 million cosmetic procedures were performed in the USA. This supposed a near 300% increase since 1997. Liposuction is the most common cosmetic surgery in the USA, with 364,000 procedures in 2013, and 16% increase from 2012. More specifically, liposuction is the most common cosmetic surgery overall in men, in adults aged 35 to 50, and second overall in women. Liposuction is the most common cosmetic surgery in the United States. Given the significant risk, substantial financial cost, and extended recovery time associated with this surgery, developments in non-invasive cosmetic techniques have been thoroughly pursued. These procedures have grown 500% since 1997 and now account for 83.5% of total cosmetic procedures, with around $12 billion in total expenditures. In addition, non-invasive devices for body contouring have become the fastest growing area in the aesthetic medicine. Invasive techniques. As I previously commented, the most extended invasive technique for fat removal is the lipoplasty. The lipoplasty is a technique that removes deposits of excess fat from specific areas of the body by inserting a cannula throughout one or more tiny incisions. This cannula first releases a tumescent anesthetic mixture that reduces the aggregation between the lipocytes and protects the surrounding tissues. Then the fat is suctioned. Well, on the other hand, non-surgical fat reduction techniques are minimally invasive treatments that selectively break down fat cells in specific areas to reduce the size of subcutaneous fat deposits. There are currently 5 leading non-invasive techniques approved by the FDA, United States Food and Drug Administration, that cause the efflux of triacylglycerides from fat cells and result in either reduced size, necrosis, or apoptosis of target adipocytes in localized subcutaneous adipose tissue without surgery or downtime. They are high-intensity focused ultrasound, unipolar radiofrequency, low-level laser therapy, acoustic wave therapy, and cryolipolysis. Several clinical studies have confirmed the safety and efficacy of various non-invasive devices for fat reduction that follow the techniques by observing clinically relevant factors such as patient satisfaction, recovery time, time to peak results, and longevity of effects. On the chart, we can see the main techniques and some of their characteristics. Invasive versus non-invasive techniques. Although liposuction is extremely effective at removing large amounts of excess fat, it is accompanied by a significant risk of complications and severe adverse effects, such as post-procedural pain, infection, prolonged recovery, scarring, edema, etc. Long-term and potentially fatal complications may include deep vein thrombosis and pulmonary embolism, in addition to anesthesia-related complications. Meanwhile, non-invasive techniques reduce practically all the related risk and partially the side effects, but is significantly less efficient for large amounts of fat excess, making this method ideal for non-obese patients seeking safer, more affordable methods or modest reductions of localized fat deposits without the serious adverse effects and significant downtime associated with surgery. In this class, I'm going to focus in high-intensity focused ultrasound and cryolipolysis. First, I'm gonna start with high-intensity focused ultrasound. High-intensity focused ultrasound is a method used in medicine for non-invasive tissue heating and ablation used for treating some disorders, including shockwave lithotripsy, uterine fibroids, and solid organ tumors. This method is extended to non-invasive fat removal processes by delivering high-energy ultrasonic waves, focusing them on the subcutaneous adipose tissue. Intensity focus ultrasound works by focusing high-intensity ultrasonic waves at the level of the subcutaneous adipose tissue, causing focal coagulative necrosis with contraction and thickening of adjacent collagen bundles while sparing the overlying tissue. At the skin surface, the intensity of the waves is low enough to avoid tissue damage. However, at the level of the subcutaneous adipose tissue, the waves are focused on a high enough intensity to provoke hyperthermia and internal cavitation. By causing molecular vibration, a rapid heating is generated, desaturating the adipose cell proteins, resulting in coagulative necrosis. Also, the ultrasound waves creates cycles of reduced and increased pressure, generating bubbles that implode, releasing energy, causing mechanical damage on the adipocytes and inertial cavilation. As the adipocytes die, they release chemotactic factors that induce a mild inflammatory response, attracting macrophages that phagocytize and clear the extracellular lipids and cellular debris. The ultimate result is reduction of the subcutaneous fat layer without damaging the surrounding tissue. Studies have been carried out. For example, Seck et al. Studied the technique in healthy patients with a body mass index of around 30 kilograms per square meter and subcutaneous adipose tissue over 2.5 centimeters at the anterior abdomen, treated with 161 joules per square centimeter, obtaining an average decrease of 2.1 centimeters, but with a discomfort rated by the patients of 5.7 over 10. Also, other reports that ask patients report that the 90.2% of the patients report procedural pain. Post-procedural pain in a 56.6%, ecchymosis on the 66.4%, and erythema on treatment sites on the 45% of the cases. Most of the adverse effects are solved within 4 weeks, without an additional treatment, and all by 12 weeks. The main limitation of this technique is that it's entirely cosmetic. It doesn't provide a solution for obese patients or reduce the risk of cardiovascular or metabolic diseases, as it's not targeted visceral fat. On this slide, we can see some market devices, such as Liposonics and Liposell, which will be used as an example on the following video. I'm going to explain another non-invasive technique for fat removal, the cryolipolysis. Cryolipolysis is a non-surgical approach that uses controlled cooling to decrease subcutaneous fat without damaging surrounding tissues. The temperature used on this technique ranges from 5 to -11 Celsius degrees, causing cell death uniquely on fat tissue, without apparent damage on the overlying skin or nearby tissue. The cryolipolysis device is placed by a doctor on the area where the fat tissue wants to be reduced. This device creates a vacuum effect, sucking the area and then starts cooling the zone. gradually decreasing the temperature of the zone till it reaches the temperature previously set by the doctor. The temperature is regulated in every moment by a sensor actuator system. In cryolipolysis sessions, this procedure is repeated in several zones of the body, depending on the desires of the patient. Cryolipolysis effects are not immediate, but in a time span of around 2 months after the session, a significant reduction may be obtained. The physical basis of the technique relies on the fact that the adipocytes are less tolerant to the cold than the surrounding tissues that it's found on the non-visceral fat reserves. So, the freeze released by the device triggers an inflammation response on the adipocytes, stimulating apoptosis. That is, the programmed death of the cell, favoring the gradual reduction of the fat layer. We can observe the representation of the process divided on 3 steps on this slide. Seligson et al. Carried a study within 42 patients being submitted to the cryolipolysis technique through 16 weeks. The main results show an average fat layer reduction of 2.8 millimeters, and circumferential measurements indicate mean reduction of 0.9 centimeters. The same study provides questionnaires to the patients, revealing that 93% were satisfied, 84% noticed visible fat reduction, and 91% were likely to have a second treatment. Also, there were not device or procedure-related serious adverse events throughout the patients. The cryolipolysis have some limitations. One of them is that even if it does not suppose a risk on the patients, as there are not related serious adverse effects, there are still some few minor problems. For example, almost all patients develop erythema, edema, or dysesthesia in these treatment zones. Also, as stated by Seligson et al., high percentage of the patients experiment discomfort. 55% of experiment pain, and around 25% experiment bruising. Also, as cryolipolysis is a relatively new technique, there are not enough scientific studies, and there is a concern on the possible long-term appearance of nerve fiber damage. Finally, the results are entirely cosmetic. It doesn't provide a solution for obese patients or reduce the risk of cardiovascular or metabolic diseases, as it's not target visceral fat. On this slide, we can see some on-market devices, such as MED 340, CleanPro, or Cool Sculpting, which will be used as an example on the following video.
So how does Cool Sculpting work? It all begins with a consultation, where you and your doctor will assess your problem areas and create a treatment plan based on your goals and realistic expectations. Then you'll book an appointment to lose that stubborn fat. On your Cool Sculpting treatment day, you should arrive wearing loose, comfortable clothing. The technician will apply a gel pad to protect your skin. Then the applicator delivers vacuum pressure and cooling to the targeted site. As the applicator pulls the bulge into the cooling panels, you will feel a firm tug and pinching and intense cold. There may initially be some tingling, but this typically subsides as the area gets numb. The fat cells are targeted and cooled, triggering their natural death. And because fat is more sensitive to cold, surrounding tissue and muscles are not affected. Over the course of the next few weeks, your body begins to naturally eliminate the dead fat cells. As the fat cells are eliminated, the remaining cells condense, resulting in an overall reduction of the fat layer. Depending on your personalized plan and goals, your treatment may last from 1 to 3 hours. When you're finished, you can return to your normal activities, including your workout routine. Some side effects may occur, including bruising and redness, numbness, soreness, or tingling, but they are only temporary. In the weeks and months that follow, you will see an undeniable reduction of fat, and as long as you maintain your healthy lifestyle, the treated fat cells won't come back.
The main conclusions of the presentations are that aesthetic and specifically fat removal market are huge and constantly growing. Non-invasive fat removal processes are much safer and cheaper than the invasive ones, but also less effective. Even if high-intensity focused ultrasound and cryolipolysis are effective, they are both purely aesthetic. And fat removal processes don't substitute a healthy lifestyle, a balanced diet, and exercise. These are the references in which the info exposed on this class is based. If you have any doubt or any question, you can just write me on my personal email and I'll be happy to help you. Now we are going to do a Kahoot. You only have to follow this link.